Inferior blepharoplasty. The superior and inferior eyelids are one of the first areas of the face that exhibit the aging process. In the majority of patients, these changes can be caused by several factors, such as genetics, lifestyle, and the normal aging process. These all lead to excessive skin and protruding fat pads that have increased in size, leading the face to have a tired and aged appearance. The fat deposits in the lower eyelids get progressively larger and then protrude, causing apparent bulges and puffiness under the eyes. At the same time, the skin begins to sag and wrinkle, due especially to the breakdown of the collagen and elastin within the skin tissues, causing the skin itself to lose support and elasticity. There are two variations of surgical techniques for the inferior blepharoplasty, which are performed according to the type of patient and the surgeon's choice. The external technique, or transcutaneous, is performed through an incision placed immediately inferior to the root of the eyelashes. This technique is appropriate for patients who have excessive skin, wrinkles, and sagging, but no bulging or protruding fat pads. The internal technique, or transconjunctival technique, is ideal for patients with protruding fat pads, and it is performed through an incision at the conjunctival aspect or site of the eyelid. In the majority of patients, surgery is performed under local anesthesia and IV sedation. But in cases where multiple surgeries are being performed, it is necessary to have the patient under general anesthesia. In order to protect the eyes, plastic shields similar to contact lenses may be placed over the eyes during the surgery. Personally, the technique used most is the internal or transconjunctival, using a laser to make an incision into the conjunctival aspect of the eyelid. This is a simple maneuver which allows the removal of the excessive fat pads under the eye. At the end of the procedure, the excess skin is removed through an incision placed by the roots of the eyelashes in order to improve the wrinkles and sagging of the skin at the eyelid. In order to reduce the postoperative inflammation, patients are prepared with natural anti-inflammatory medications 2 to 3 days prior to the procedure. Thus, the majority of patients are able to resume normal activities within 2 to 3 days. Normally, the sutures are removed at the 4th day after surgery. Improvement is noticed immediately after surgery, reflecting a natural and youthful look.